a spotlight on the critical facet of diabetes care, that is, the significance of initiating fitness prescriptions. In the next few moments, we'll be dwelling into why prescribing exercise is just not an option, but a fundamental component in the comprehensive management of diabetes. We have seen that diabetes has undergone a paradigm shift in the past few years, and no matter which guideline you see, lifestyle and diet modification has always been the first line treatment, which usually gets neglected. So that's why we are here to tell you the importance of that. So as we navigate through this brief but impactful session, we'll uncover the compelling evidence linking to physical activity and its importance in, glycemic control, cardiovascular health, and overall well-being in individuals. Also covering some of the important points, that is the complications of diabetes and the importance of fitness in that. So our focus is not only the theoretical understanding, but also the practical aspects of integrating, the fitness prescription seamlessly into your patient care routine. So today, we have with us an eminent speaker, that is Dr. N.K Singh, sir. Thank you, sir, for being with us here today. And, thank you for taking us through the journey to understand why prescribing fitness is very important, especially when we talk about, Indian patients, because we already have a high carb diet. We have a certain phenotype that links us to the high, incidences of diabetes. So just as everybody knows, sir, but just a small introduction of sir. Sir is, like I said, he's a consultant physician and diabetologist, and he is also the founder and editor of CME India. He has been chairman of RSSDI Jharkhand. He's current chairman RSSDI and Jharkhand chapter. He is an executive member of National RSSDI. He is ex-governing body member of National API. He is editor, Millennium Book of Medicine. He's associate editor for Postgraduation Medicine 2021. He has edited monograph on COVID by ICP and API 2023. He has almost 40 national as well as international publications. So, sir, giving you the platform to enlighten us with why fitness prescription is very important.
Thank you, Dr. Priyanka. I think this is a great pleasure for me to talk on a subject which is at the heart. I like it. So first, let me share the screen. So good evening to you all. Today we are going to discuss a very, very important thing, that is the customized exercise prescription in the management of the type 2 diabetes. And as you are seeing that how this revolution is not in proper way you are following. So what we are going to do today, that we give you how to generate a prescription in your type 2 diabetic patients. The first thing to understand is, similar to a drug, exercise has to be prescribed in modality, dose, frequency, with not only a pathology, but also a personalized patient approach. This is very, very important. And new data are needed to make this new science not only evidence-based and personalized, but also a precision approach. And this is slowly happening. This is a photo which I took at the ADA, where there was a very good lecture. There is an amazing science of exercise. Why do we fail to follow? And this lady you are seeing, she told that any movement is better than none, and appreciate the labors of sustainable behavior change. You can see the very famous quote by Plato, 400 BC, that in order for man to succeed in life, God provided two means, education and physical activity. Lack of activity destroys the good condition of every human being, while movement and methodical physical exercise can save it and preserve it. And I will say you, this is a great saying. But when you go for the prescription for exercise, you can see, if you take this Hippocrates, he was the father of scientific medicine. And it is said that he was the first physician to provide a written exercise prescription for a patient. But if you go back, 600 before the Common Era in India, the great saint, the Susutra, Susrut, he was the first physician to prescribe moderate daily exercise to his patients. This is not quite clear. So when you are going to generate a physical activity prescription for your patient, remember there are five key elements. Number one, first you should assess your patient. Second, determine what are the priorities of health issues. And then you identify the patient capacity and intervention sustainability. And then you will have to generate exercise prescription. And that takes how much the exercise, what is the data dose? Like you write the dose of a medicine, in the same way, you should write after the assessment what is the total exercise dose, what would be the mode, what should be the intensity, what should be the frequency, what should be duration. And then you should monitor, educate, and behavior change should be sustained. And further, you should reassess, and then you can modify your prescription. So components of exercise prescriptions is specific, like you give the type of exercise or activity, like walking, swimming, or cycling, a specific workloads, duration and frequency. I'm just repeating it because this is very important. And your intensity guidelines like target heart rate. And also there is a scale known as RPE, that is the range, the estimated rate of perceived exertion. And then precautions regarding certain orthopedic or other comorbidities, which we'll discuss. So I told you that first you need to generate exercise prescription. Well, you are writing in a piece of paper. This is your main prescription, where basically all of us are just writing 30 minutes, 40 minutes, or 60 minutes of exercise you should do. And we are just giving hardly 30 seconds to even 1 minute that you should do some exercise. But that's the reason the whole mission fails. So you should have a separate piece of paper where this type of things should be there, like this exercise prescription. You just give the discussion time. You can write whether it should be, preferably has been told to 20 minutes, but I think that in such a busy clinic, we cannot go for 20 minutes, but even for 3 to 5 minutes, you can do this with the help of your educator, diabetic educator. They will enter the name, age, sex, other things. Then 3 parameters you are saying, that is the fit. That is the fit is what is fit? You know fit. That is the frequency, intensity, time, and type. And then what is the status you assess? Not active, no intention. Whether the patient is not active, but there is intention that they can start the exercise. And some activity not enough. Suppose patient is saying that I'm walking for 5 to 10 minutes. This activity is not enough. Action just started last 6 months, and maintenance, whether the patient is active after 6 months or not. And then you will recommend about also the food care, aerobic type, resistance type, heat, I will tell you, and some yoga postures. And the checklist should be there. Recently, this sort of prescription has been also reviewed. But as this is a bit monotonous and something is missing in this prescription, let us think what is missing. Now, if you just move that prescription to move, that is, move to optimize your vitality and enjoyment. So your prescription of exercise should generate interest and enjoyment to your patient, and then that will never fail. If the patient like your prescribed exercise, they stick to it. They will like it, and if they see the results, be it less fatigue. Suppose the exercise you have generated, you're told that each patient is getting more vitality and feeling much better and better, they will continue it. So this is quite important to understand that in your prescription, the joy and effectiveness of the exercise should come into. So this is a second type of exercise prescription, very simple one. Choose to move. Here we are showing you the vitality. You just tick it. Less stress, stronger or relaxed what the patient is feeling. Whether with the exercise brings the joyful or feel in control, well-being and better mood, you just tick it. Whether your exercise brings enjoyment and fun, and patient becomes less anxious, connected, and enhance test drive and clear my mind. So these are things you can do, and just write a simple way. Well, walking 60 minutes per day, fast walking, or patient just want to swimming, playing, dancing, patient wants yoga or gym going, gardening, or any other sort of exercise, which I will tell you. So you tell that this exercise, if you do, this is not going to bring the long-term enjoyment or long-term benefits, but you do today and you get the results today. And this happens. And then before starting or telling what sort of exercise, how much to exercise, you just have some sort of assessment that is quite important. So exercise as a prescription for patient with various disease, that is aerobic, resistance, or whatever it may be, you have to see the nervous system, cardiovascular system, respiratory system, and I don't think this takes too much time. So first thing is the medical clearance. Before starting activities, more vigorous than brisk walking is recommended for adults with sign or symptoms of CVD, longer diabetes duration, older age, or other diabetes-related complications. Suppose a patient is having a blood glucose level of more than 250 milligram per DL, and if moderate or high levels of blood or urinary ketones are present, definitely that should not begin the exercise. And also the blood glucose more than 300, it has been said that without excessive ketones also, if the patient is hydrated, and only begin if feeling well. And suppose a patient is taking sulfonylurea or taking insulin, it is important to carry rapid-acting carbohydrate source during the physical activity to treat hypoglycemia. So this should be also explained. And well, glucagon is hardly available to treat severe hypoglycemia in most of the places, so I'm not going to. This is a, also you can assess your patient by these two RPE scales, the original Borg scale and the revised category ratio scale. I'm not going into detail. If you are interested, this is available on the Google, and you can rate it 1 to 10. But again, this will take some time, and it is not possible in busy clinic. The second part. So this is your the way you are generating your prescription for a diabetic patient. Again, this will not work. So what you should do, that you just give 2 or 3 minutes, and in the local language, you tell to your patient about the science of exercise. And once science of exercise gets imprinted in the patient's mind, he or she will stick to exercise for very long periods. So I show few or 3 slides. This is the Phil Sutherland, you see. He was a type 1 diabetic patient. When he got diabetic at the age of 6 months, that time doctor said that he will not survive for more than few years. But today he is a role model. He has created a Team Novo type 1 diabetes exercise program, and many of the guidelines has been generated by himself. I met this person. He told that exercise is a $1 billion drug that never gets prescribed. So you all are aware that what are the things which exercise can bring, including the memory, the bone health, and other things. So everything should be told to the patient. But your diabetic patient need to be told about the CMGU. So this is the mantra I tell. The contraction mediated uptake of glucose. So we say our patient that insulin is not required for glucose to enter into the cell when you exercise. What is known is that this pathway is not affected by people with type 2 diabetes. Even in type 1 diabetes, this becomes a boom. So a form of non-insulin dependent glucose uptake, contraction mediated uptake. It is so essentially muscle contraction allows glucose to enter into the cell. So I tell my patients, so much glucose in your blood, you move your muscle, it will, then the glucose will enter into the cell and it will burn, and then you get the energy. So this is the way we, in a very simple terms, in your language, you can tell. And then also apart from the aerobics, because there is a concept that you go and you run, and you swimming and cycling and 60 minutes of fast walking. But apart from that, it is quite clear these days and it is recommended by all the recent guidelines that in diabetics, the resistance exercise is very much effective in improving the insulin transporter number and the function. And if you, due to the intermittent nature of the resistance exercise, it has been found that it is even better tolerant than the aerobic exercise. And those who suffer from fatigue and musculoskeletal disorders like osteoarthritis, this becomes a boon. So resistance training is highly effective in slowing the sarcopenia. These days, people are talking about the sarcopenia, sarcopenic obesity, which is a major issue in diabetes, and it is a close association with the type 2 diabetes. And for this, aerobics does not work at all. Only the resistance exercise works. So this should be told to your patient. So there is some difference. You should know what happens if you are doing aerobics and what happens when you are doing resistance exercise, about the muscle hypertrophy, muscle strength and power, muscle fiber size, neural adaptations, anaerobic capacity, myofibrillary protein synthesis, everything. The green one you are seeing up is going, this happens only with the resistance, but here you can see with aerobics, this does not happen. In the same way, for the aerobics, again, there is lactate tolerance and mitochondrial density increases, endurance active capacity increases. Here, the resistance exercise is not showing green one. So it clearly, this cartoon gives you a message that combination of both will work better. So let us see. And then in Corona days, I used to show this slide that how this was important even for the innate immune systems, cell components between lymph node tissue and the blood components, and immunosurveillance by the exercise. So how exercise augments host immune defense is multifaceted, but a key mechanism, mobilization and redistribution of effector lymphocytes. Literally, recent studies have found that billions of lymphocytes are mobilized in response to just a single bout of exercise, particularly if the exercise is dynamic and taxes the cardiorespiratory system, like running, cycling, and throwing. So there is a cathepsin-mediated preferential mobilization of those lymphocytes, and this is looking for a fight and kill the virus-infected cells. So you can tell your patients to enhance or to boost your immunity, you need nothing but exercise. And then this is a new mantra which is coming from this research, that make your mitochondria green. If you see here, the sedentary portion, the mitochondria is not looking totally green. But if a patient of the exercise trained person's mitochondria, green means all the useful chemicals, or even the mitophagy, exercise induced mitophagy, you can see that acute exercise induces further mitochondrial stress and initiates the process of removing damaged, dysfunctional regions of the reticulum through mitochondrial fission and mitophagy. So long-term exercise training results in improved mitochondrial quality. So I think these are few points. This is the second part of my talk, where I say that you must first tell in the first interview with your newly diagnosed patient about the science of the exercise. This is the first thing. The third part is to tell what sort of exercise you can do. But remember that you have to somehow motivate your patient to do the aerobics and also do this resistance exercise. So what is the aerobic exercise? This is a short-term aerobic exercise training. This improves insulin sensitivity in adults with type 2, paralleling improved mitochondrial function. And if the patient goes for vigorous aerobic exercise training for 7 days, that may improve the glycemia without lowering body weight via increased insulin-stimulated glucose disposal and suppression of hepatic glucose production. And the short-term aerobic exercise in individuals with obesity and type 2 improves whole body insulin action through a gains in peripheral insulin sensitivity more so that than the hepatic insulin sensitivity. So this is very important, which improves insulin sensitivity, lipids, blood pressure, metabolic parameters, and fitness levels and other things. So this is quite so important. And then the few things you are seeing in this slide is how you can do the resistance exercise at home itself. So resistance exercise training in adults with type 2 diabetes typically results in 10% to 15% improvements in strength, bone mineral density, blood pressure, lipid profile, skeletal muscle mass, and insulin sensitivity. So combined with modest weight loss, resistance training may increase lean skeletal muscle mass and reduce the HbA1c threefold more in an older adults with type 2 diabetes compared with a calorie-restricted non-exercising group that lost skeletal muscle mass. So do tell your patient not to miss the benefit of the resistance exercise. You can see this, they improves the body composition, improves blood lipid profile, improves immune function, increased muscle mass, greater oxidative capacity, improved physical function and mobility, and improve the blood glucose and insulin sensitivity. So so many things are happening. And then you have to tell about the combination. Intervention with combined aerobic and resistance exercise training may be superior to either mode alone. A greater reduction in HbA1c has been noted in adults with type 2 diabetes undertaking a combined training program compared with either type alone. So again, this science has to be told to your patient. Suppose you are doing the both aerobics and the resistance exercise. You see here, the insulin sensitivity. If only both aerobics and exercise acutely enhance acute insulin sensitivity 20%. Either training regimens further increase insulin sensitivity 40% and improves HbA1c levels by 0.4 to 0.5%. But once you going for the combination of aerobic and resistance training, it jumps from 20% to 70%. And lowering of HbA1c from 0.4 to 0.5% to 0.9% to 10.6%, 0.9%. So this is how important it is to combine the both. And you can see what are the components of different exercise pattern. But you see about the yoga, if you are doing yoga, you have got some aerobic component, resistance component is more, flexibility component is more and more, and balance component is again much better. But if you're walking, it is basically doing the aerobic component. If you're jogging and running, it is again the aerobic component. But cycling, again, it is aerobic component. Dancing, again, aerobics. But the weight training, if you are doing, this is the resistance component is more and more. And suppose patient will tell, I don't have time, 1 hour or 30 minutes or even 40 minutes. If the patient is in good shape, you can go for the high intensity interval exercise known as the HIIT. This is really a HIIT. So what happens? If patient is walking and then going up to the heart rate peak from 10 seconds to 4 minutes, with 12 seconds to 5 minutes of active or passive recovery. So I think this is a separate thing to discuss how to do high intensity interval training. But I have just to tell you that this is considered superior to low intensity training. It results in greater fitness, better body composition, improved continuous glucose monitored glycemia, as well as enhance insulin sensitivity and pancreatic beta cell function. So this is again a very important form of exercise. For those who don't have time, it takes hardly few minutes, 4 to 5 or 10 minutes is quite okay. If you are trained with the high intensity interval exercise, that is known as sprint, SIT, or moderate intensity continuous modeling. I'm going for again running if possible. A patient is in good shape, you can say about the running. That add 10 minutes for your health. This is a new Japanese recommendation for physical activity based on dose response analysis. And this is quite interesting that a 5-minute run generates the same benefit as 15 minutes walk. And if 25-minute run is equivalent to a 105-minute walk. So this running event for 5 to 10 minutes per day, and even at a slow speed less than 6 miles per hour, is associated with markedly reduced risk of death from all causes in cardiovascular disease. This is a study which has shown it. Most of our diabetic patients these days are tuned to yoga. Well, this is must be included in the lifestyle modification, as yogic practices also are likely to play a role in prevention of type 2 diabetes. What happens? There is upregulation of insulin receptors and the normalization of the insulin glucose ratio that occurs following yogic practices. Although slowly the evidence is coming up that how it improves the insulin sensitivity and reduce insulin resistance. And many research are going on, even not only in India, but even in the US. And this I saw because again, the people will say that we don't have much time. I say, if you don't have much time, you just give me 5 to 10 minutes and do only 12 rounds of Surya Namaskar. This is such an exercise which has got the aerobic components, resistance component, balance component, everything is available combination. So it improves cardiovascular function. Surya Namaskar is the combination of asana and pranayama, and it is simple to practice, consumes only less time, and that everyone can practice it in every day. And these days, patients have lots of mental agony. So if you do it with the mantra, then suppose you are a patient, your patient tells that I am in a bank or somewhere where I am sitting whole day, then concept of interrupted sitting you can tell. Again, you can prescribe it in your prescription, how the interrupted prolonged period of sitting and just 15 minutes of walking after meals, either light walking or simple body weight resistance activities undertaken for 3 months after every 30 minutes of inactivity can improve overall blood sugar control. Because some small trials showed that reducing the sedentary time by interrupting prolonged sitting with brief bouts of walking or light exercise reduces hyperglycemia and improves insulin sensitivity in sedentary type 2 diabetic patients. So this is again, lots of research papers have come up, and this shows how the sitting plus 3 minutes bouts of light intensity walking, or you are sitting and then 3 minutes bouts of simple resistance activities in the office, that can improve the whole metabolic parameters itself. So the daily movement also becomes very important, because lots of your housewife will tell that they're doing some sort of activity in the kitchen, in the garden, and some are walking with their dogs. So this is also a very important thing, that you can encourage those movements that is known as daily movements. Even the research papers are coming up that those having the dogs and moving the dogs ownership have better physical activity. And then there are lots of physical activity recommendations by ADA or some other sports association. I will not go in detail here, but I have told you about the aerobics, resistance, flexibility, frequency, duration, and you can look for that. This is what I once published in one, I think in the update medicines, what should be intensity, what should be the duration, that should aerobic at least 150 minutes per week at moderate to vigorous intensity, and resistance exercise at least 8 to 10 exercises with completion of 1 to 3 sets of 10 to 15 repetitions to near fatigue per set. And this should be done how frequent? Resistance exercise should be done a minimum of 2 non-consecutive days per week. But you can, if you do 3 times per week, that will be much better. So I think this should be, again, for resistance exercise, the frequency is at least minimum of 2 non-consecutive days it should be done. 3 will be ideal. And other types of exercise I told you. Now the few questions people will ask, what is the timing? The morning should be done or evening? Knowing precisely when to exercise each day to maximize the benefit is less well understood, but with the chrono medicine coming up, it has been shown that afternoon exercise is more efficacious than morning exercise in improving blood glucose levels in individuals with type 2 diabetes. This is on behalf of a randomized crossover trial. But it will be better to tell whatever time suits to your patient, morning, evening, and even afternoon, or even in the night. That's okay for me. But research paper tells in the Diabetology that afternoon gives better timing. So afternoon exercise is more efficacious than the morning exercise. And improving the blood glucose levels in individual with type 2 diabetes. Exercise after you eat, hitting the postprandial glucose target. This has been all, I think, evidence-based. So you can tell your patient, and if the patient asks which one is important, intensity or duration, what you tell? Current research clearly says that intensity is more important than duration. So at low intensity for an extended period of time, what happens? The fat becomes the primary fuel source. And this is far less effective at lowering the blood glucose levels. But intensities ranging from moderate to high utilize more carbohydrate, that is glycogen for fuel, and therefore are more effective at lowering blood glucose level. So this part is only for lowering the blood glucose. And how much? If you just see here, why did this gentleman known as David die? And when the marathon started, the Greeks sent their fastest runner to carry home news of the victory. He sprinted 26.2 miles from the battle site to the city state of Athens. He arrived and said, "Rejoice, we conquer," and died from the exhaustion. So this is marathon race is named after him. So we need a customized exercise prescription, and this is the clear-cut example of that. So exercise is medicine, and the dose matters, because now you can have a few scenario like a newly detected 26-year male, HbA1c 7.9, there is no comorbidities. Here you can give whatever you like, the exercise modality patients wants. But in the patient where there is some sort of osteoarthritis of both knees, or there is some defective proliferative retinopathy, some cardiovascular problems, autonomic neuropathy or peripheral neuropathy, or with pregnancy, this is a separate discussion. Someday we can discuss. But because for such patients, we have to be very careful to customize the prescription. But just in 2 or 3 minutes, I will like to tell you that concerned with the hypoglycemia, that use of select medication for type 2 diabetes may increase the risk of exercise-related hypoglycemia, including insulin and insulin secretagogues. But no medication dose adjustment or carbohydrate intake is necessary for other oral medications or non-insulin injectables such as GLP-1 agonist. So, but for the high-intensity exercise may be problem for those taking insulin, and finishing an exercise session for a short high-intensity bout has been shown to be beneficial. So you have to be very careful. Even for the hyperglycemia patients, I told you in the beginning how it should be managed. And some non-diabetic medications, we should be careful. Like beta blockers blunt the heart response sometimes, and beta blockers may increase the risk of hypoglycemia unawareness. but beta blockers can also increase the exercise capacity in people with type 2 diabetes and CVD. And patients using beta blockers, rating of perceived exertion should be utilized to monitor exercise intensity. So these are few things we should know. And even for the autonomic neuropathy, be aware of the increased likelihood of hypoglycemia, abnormal blood. I told you that intensity and duration is, which one is more important. So this is a big important slide that current research clearly demonstrates that intensity is more important than duration. At low intensities for an extended period of time, the fat becoming the primary fuel source, this is far less effective at lowering blood glucose levels. And intensity ranging from moderate to high utilize more carbohydrate, that is glycogen for fuel, and therefore are more effective at lowering blood glucose levels. And this is important a story of how marathon started. The Greeks sent their fastest runner to carry home news of the victory. He sprinted 26.2 miles from the battle site to the city state of Athens. He arrived and said, "Rejoice, we conquer," and died from exhaustion. So marathon was raced. So this is very important. That exercise is a medicine and the dose matters. And when you come up with the patients like osteoarthritis, detected proliferative retinopathy or autonomic neuropathy or peripheral neuropathy or pregnancy or some cardiac issues, I think we will someday discuss how to deal all those with hypoglycemic cases, with hyperglycemia cases, and even you should take care of the non-diabetic medications. But autonomic neuropathy is important, but the peripheral neuropathy is a very common problem. Limit exercise participation that may cause foot trauma, such as prolonged hiking, jogging, or walking, or uneven surfaces. And you can non-weight bearing exercises like cycling, chair exercises, swimming may be more appropriate. And check fit daily, choose shoes and socks carefully. These are few things we can do. You can just have a word about the diabetic retinopathy. If the patient is of mild, all activities are permitted. But early eye examination is necessary to check the progression. And for moderate non-proliferative disease, activity like powerlifting, which may significantly increase the blood pressure, should be avoided. In severe and non-proliferative and unstable proliferative retinopathy, all physical activity that may increase intraocular pressure and risk of hemorrhage should be avoided. This is again a very important point to understand, because recently there was a news in the Medscape that exercise is better than the Viagra. And why it happens? Because it improves the erectile dysfunction. And we don't tell our patient that do exercise just to treat it. All these exercise, you can see this here. It has been clearly shown that individuals with sexual dysfunction, particularly women, who were not persuaded by the currently publicized benefits of physical activity, may be inclined to exercise to improve their sexual functioning. So we have evidence is coming up concluding that higher cardiovascular exercise levels in physically active adults are inversely associated with erectile dysfunction by self-report in men and protective against female sexual dysfunction in women. So again, this is a very good news, which is recently come up, that exercising 2.5 hours a week can boost your testosterone level and decrease instances of hypogonadism by 46%. This is a really excellent one. So physical activity interventions show the largest effect sizes in terms of efficacy for the treatment of erectile dysfunction. And how it does, I am showing you all the references here. So here to tell that exercise has positive effect on the sex drive of men. Exercise has positive effect on the sex drive of the women. So can you tell it about it? Increasing sex drive can be a goal of an exercise program, but it should, So increasing sex drive can be a goal of an exercise program, but it would be wise to incorporate additional goals that will be much better. Now, just I will take 2 minutes and then end up my talk. What is the Soleus push-up? Is it a new sensation? You see here, what is Soleus push-up? This is a new thing which is coming up last year when Dr. Hamilton in his controlled lab showed that when I do a Soleus muscle push-up exercise, the minimal glycogen, they use the minimum glycogen, so less competition with other fuels, and they improve the metabolic control, even the 50% reduced postprandial glucose, less hyperinsulinemia, and improved lipid metabolism. So again, this is another could be talk how Soleus push-up. This is a Soleus muscle. You might have forgotten it, but this is a very, very important muscle, this Soleus, in between the gastrocnemius muscles. And I told you that the muscle fiber type are classified into fiber types, particularly slow twitch versus the fast twitch. And the fiber types are generally defined by particular myosin heavy chain isoform. And a skeletal muscle fiber type can have a profound impact on muscle diseases. So what happens, you see how we do the Soleus push-up. You see here. So this is the way, exact way of doing a Soleus push-up. Although there is no real world studies, whether the whatever Dr. Hamilton has told
right where the ankle's
about the improvement in the all the glucose parameters and lipid profiles that happens in a diabetic patient or not, because those have been shown in the non-diabetic patients. So I'm just going to start a study whether it is effective in real world scenario known as field study. So we will just starting this and doing those patients we will be recruiting, not able to do intense activities, aerobics, resistance, and you can do it even you are watching the TV, you are just on your chair and you can do for 20 to 30 minutes per day. And this is a really very, very important form which might emerge in future. So because they have found that the group that performed the Soleus push-up while seated in the laboratory, they performed up to 270 cumulative minutes and spread throughout the day and experienced dramatic improvement in blood glucose regulation, in metabolism, despite the fact that the Soleus is just 1% of the total musculature. So this is how will kidney disease, hypertension, you have to take care for the heart patients, coronary patients, and there should be a customized exercise prescription again in GDM in pregnancy. So I'm not going to tell the things now, even for a foot ulcer, how we go for that, in peripheral arterial disease, in exercise in older adults, again a separate topic. So I think I will end here. You and telling you that this is the way we are going to generate the exercise prescription with all the science behind that. So I think I will end here. Thank you very much for.
Thank you so much, sir. First of all, to explain us the importance of fitness prescription, as we know that all the guidelines have mentioned fitness, fitness and diet as the first line. Yet we have a lot of patients when while treating them, and we have very limited amount of time. So I do have a lot of questions, and there are a lot of questions from the audience. But before that, I would like to share a video. So, like sir has said, the intensity matters the most, but exercise is important, even if you do it for 10 minutes. It will help in reducing the cardiovascular disease or the cardiovascular complications that you might have. And the fitness or the exercises needs to be addressed as per the complications as well that the patients have. But these set of exercise that I'll be showing it to you in few seconds can be used in majority of the T2DM patients. So at least you can start with something to prevent the complications. So this video was actually made with the help of physiotherapists from Nair Hospital, and they had made a wonderful video which can be useful for the patients which have T2D.
Straight leg raise pose. Lie down straight facing the ceiling. Hand touching the ground, palms facing downwards. Bend your left knee and lift your right leg up, straight to the level of your left folded knee. Breathe normally. Hold this pose for 5 counts. Feel the stretch in the lower back. Release and return to the starting position. Repeat this process 10 times at your own pace with alternating legs. Biceps curls. Take 2.5 liters of water bottles. Hold one water bottle in your right hand and another in your left hand. Sit straight, upright, and keep your arms by the side of your body. Now slowly bend your elbows inwards towards your chest and then lower it back to the side position. Repeat this exercise 10 times. Side stepping. Take a 1 feet high stepper or a box which can bear your weight or any plank, wooden part, patla available at home. Keep it on your left side. Now step up on the box or plank with your left leg and stand straight, pausing for a while. Get down on the other side of the plank, putting down the left leg first, followed by the right leg. Repeat this exercise 10 times with both the left and right leg. Bridging pose. Lie down straight, facing the ceiling. Bend both legs from your knees and squeeze your buttocks. Hands touching the ground, palm facing downwards. Slowly lift your waist up, resting your head down on the ground. Breathe normally. Hold this pose for 5 counts. Release and return to the starting position. Repeat this process 10 times at your own pace. Side straight leg raise. Lie down on your left side. Bend the left knee, keeping your left hand folded towards your head, resting on the ground in a comfortable position. Now, lift your right leg straight up towards the ceiling. Balancing the pose with your right hand, holding the ground or mattress. Hold this pose for 10 counts. Feel the stretch in your waist area. Release and return to the starting position. Repeat this process 10 times, alternating side. Note, same side leg folded, same side arm rested towards the head versus opposite leg raised and balancing arm.
In terms of reducing blood sugar levels, moderate exercise is more effective than intense physical activity. 30 to 60 minutes cycling once per day for 3 to 5 days a week is enough to achieve anti-diabetes benefits. Sit with your back supported with proper leg distance to reach the pedal. Pedal at your pace for 5 to 10 minutes, then boost your speed for next 30 minutes so that you feel slightly breathless. Then in the last 5 minutes, reduce the speed for cool down. Sweating is not the indicator of exercise intensity. Keep in mind, avoid having meals 30 to 45 minutes before and after the exercise. Avoid overdoing exercise. Stop in case of any pain in the body and excessive breathlessness.
Lateral raise. Keep your feet 1 foot apart. Put TheraBand under 1 foot. Keep your arms out, thumb pointing up. Lift your arms from both sides with the TheraBand stretched till the chest level. Hold for 5 seconds and bring down to side. Front raise. Keep your feet 1 foot apart. Put TheraBand under 1 foot. Keep your arms facing front side outwards, thumb pointing upwards. Lift your arms from both sides with the TheraBand stretched till the chest level. Hold for 5 seconds and bring it down to side. Chest press. Stand straight with feet approximately 1 foot apart. tuck your tummy in. Wrap the TheraBand around your shoulders, touching your upper back. Hold the TheraBand handles such that your thumbs face upwards. Now stretch your hands in front of your chest. Feel the pull in your muscles. Hold for 5 seconds and then release. Repeat for 5 more counts. Leg press. Sit on a chair in a comfortable position, tucking your tummy in and place the TheraBand under one of your feet. Bend your leg at the knee level, first drawing it towards yourself. Now, firmly holding the TheraBand with both your hands, press your feet downwards and hold this position for 5 seconds. Release the stretch. Repeat this again for 5 counts with each foot. Seated calf press. Sit on a chair in a comfortable position, tucking your tummy in and place the TheraBand under one of your feet. Now, firmly holding the TheraBand with both your hands, gently lift your feet till your knees or as per your comfort level. Now, push your sole outwards, feeling the stretch in your calf muscles. Hold this position for 5 seconds and repeat. Repeat this again for 5 counts with the other foot. Copying, circulation and distribution of this content is strictly prohibited.
So just to convey this, these are the basic exercises that could be advised to the patients. Now, sir, for the questions, we have tons of questions that we have received from the audience. But my first question to you is, sir, we talk about fitness prescription, but as we know that it can be difficult while, when we are dealing with the patient and the number of patients are waiting outside. So, sir, how do you deal with it? And how can we also deal with it and make fitness prescription, or how to, prescribe fitness and how to make it, convey to the patient the importance of it?
Actually, this depends. If your patient newly detected and you are counseling your patient for the first time, it is, for me, I take at least 3 to 5 minutes only to tell the science of exercise. This is for one-time job. Then you have to just monitor for in the next visits. So that is one point that we have to ask. Even I have to ask sometimes. They say that we don't have time. Then I tell when do you wake up. Accordingly, I plan the exercise and I tell. But what happens? It needs a constant motivation. So even then you have you can just refer or you can send to your diabetic educator. He can tell details about that, but that hardly works. So they want to hear from the doctor's mouth. So we have to give 2 to 3 minutes. That this is very important. And I tell that in diabetic medications, there are 3 things. The most important is the exercise. Second is the diet. And third is your drugs or insulin, whatever it may be. And that definitely then patient gets motivated. But when after, suppose 6 months or after 1 year, patient is visiting to you, and again patient is telling that, no, doctors, I am eating everything. I am not running. I am not able to. So again, when they are coming in with high blood sugar, then again you have to motivate. And such programs like today you are conducting, even the doctors, our doctors, which are watching this program, they get motivated for himself or herself itself. So whenever I go to a conference and I have make a point that suppose in ADA, in Indian conferences, if you go, they are hardly you will get 1 or 2 lectures for the exercise. But if you visit the European ESD or if you go to ADA, they are keeping 5 to 8 hours only discussing exercise. And I don't go for the clinical things rather than research papers. I go for the exercise. And this helps me to generate interest in exercise because this is my... And I think doctors should also practice. I exercise every day for 1 hour. This is even at 6 o'clock I start. I walk for 1 hour. Then I do some Surya Namaskar or yoga. And then some daily walking is the things. Although I'm not suffering from diabetes, but this is helping me out because my both parents were diabetic. So far, Even that around 60 plus, I have not developed diabetes. I don't know what will happen in future, but till now I am keeping and even I can run with my dog. So when I find that a 30 or 40 aged person is not running and walking, and they are just having shortness of breath. But I can run. I have seen that this happens. Even once I visited the Chinese wall of China, and I was given a certificate that your fitness is quite good. You do not need a TMT. So you need some motivation. You have to need some motivation. So this is the one point very important, that doctors should go motivating. But unless and until you are yourself doing exercise, then your motivation will hardly work. So you should be a role model, and before that, telling your patient, you should apply with your life also. Next. Yeah.
Absolutely, sir. I do agree with the doctors are the role model, and the patients will take us seriously if we are healthy ourselves.
Yeah.
Usually like when you're practicing, it's very difficult even to remove time. But sir, you, I mean, you are a role model for us. I think everybody of us will inculcate exercise in our day-to-day lives. So, sir, we have another question from Dr. Saurabh. He says that 10 minutes of post-meal exercise is good and good for postprandial glucose. If it's the BP is high, post-meal exercise is good. But, sir, what do you recommend?
Suppose this is you are doing a regular exercise, that is a 60-minute fast walking, that is aerobic exercise, and in a week I have told you about do the resistance exercise. Apart from that, if you are doing a 10 minutes in the slow pace postprandial exercise, just walking, that is important for reducing the postprandial hyperglycemia. So this has been recommended by the recent ADA guidelines also. So this is quite good, and this I tell my patient to do regularly, that just ki khana khane ke baad thoda sa टहला karo. So this is was a old wisdom which has been now has evidence based, and so even the people like ADA and ESD, they are recommended. So this is true. So apart from doing the regular exercise, you should also, even suppose a patient is not at all doing physical activity, then even if he or she is doing some postprandial exercise, slow pace walking, because after taking food you cannot run very fast or walk very fast, that also has been found to be beneficial. So that is quite good.
So the next question Dr. Rajiv asks is there any big evidence they study to demonstrate efficacy of yoga and pranayama?
These studies, today we have got some meta-analysis. We have the evidence is not very strong at present, because recently this has come up. I met few persons which are doing some research work on the Surya Namaskar and yoga in USA, and they told me that within 3 years they will give us something surprising results. So they are doing a very controlled study on Surya Namaskar and yoga, and they will then it will come up in some research papers, because if you go in the literature these days, we have not a very strong evidence. We have got limited evidence, but in science you need a very strong level A evidence. For that we have to generate the data. We have not done a scientific way of research on yoga and Surya Namaskar, but now it is being done, and I hope that in days to come it will be published in very important journals, and then it will be recommended.
Absolutely, sir, and our ancestors has been suggesting, but yet I think we are not following it enough.
Yeah.
So the next question is that you suggested Soleus push-up. So the doctor wants to ask that if you're doing Soleus push-up, should it be continuous for 20 minutes or it should be interrupted? Which one is better?
Should be. Actually, it's as recommended, because today in the world only we have got only one person to recommend that is Dr. Hamilton. You go in the Google, there's a very good research paper that has been published in the iScience on the Soleus push-up. He has recommended continuous 30 to 40 minutes of Soleus push-up that you can do. Suppose once I was coming from the Kolkata to Dhanbad, that takes a 5-hour journey. I did in the car only for 30 minutes, and I was really feeling very good. Immediately, whatever the cramps which I was having in my legs that went away. So I think we don't have much research now, but so far it has been recommended continuous.
So I have actually tried it. We have also mentioned it in the previous, in a previous talk about the importance of Soleus exercise. And it has helped. After a long day of working, if you're standing for a longer time, it has helped a lot. The cramps decrease. So
and you don't get fatigue. You don't feel fatigue at all, because your soleus muscle is drawing itself not glycogen but the glucose itself. So I think the moment we have just started, I think a pilot study, because on the 90 patients we have planned with the 10 centers. So this will be a very controlled study. And then when we will be able to see what happens with those patients, diabetic patients, which are not doing exercise, and just after adding this Soleus push-up, what is happening? We don't have evidence at present, I know. But because this one paper has come up that was in the controlled laboratory setup, we need the real world studies in diabetic patients. So far there are no recommendations for that. But for the first time, we are going to publish a paper that is from the IdeaCon group of the Kolkata, Integrated Diabetes and Endocrinology. That is, I think you must be knowing IdeaCon. So those group we have just that is under review in a DRS. There is a very impact factor is 10. In that journal, it will be published. In that journal, my talk was at the IdeaCon on the Soleus push-up, and we have also given a few lines about the recommending Soleus push-up. So that will be the first thing which will come up in the science, in the modern science.
So that is perfect. We'll be looking forward to your study, and maybe before ADA and ACE, we would be the first. In India, or RSSDI can be the first person to put it in the guidelines. Soleus exercise for T2DM patients. So, once again, sir, thank you so much for taking us through the wonderful session. Thank you for showing us how important it is to prescribe exercise, especially in patients with diabetes. And thank you for answering all my questions. Also, one message to our audience that this is a fitness prescription series. So now we have talked about the importance of fitness prescription. Later, like sir has also mentioned, that every complication in diabetes requires a statistical or a maintained exercise, or a designed perfectly exercise, which we'll be taking it later. So look forward to it. We will be making it exercise, and which exercise can be done in complications. Maybe we will be covering neuropathy. We will be covering patients who are elderly. So just look forward to it. And once again, thank you so much, sir. Also, we have with us our team member, that is Debashish. I would like to hand over the session to give him the thank you note.
So good evening, Dr. N.K Singh, sir, and my regards to you. And also, I'd like to thank our delegates who have joined with us. So I want to extend a heartfelt thanks to Dr. N.K Singh, sir, for such a lucid deliberation as always on fitness prescription tonight. And sir, your expertise not only showed the importance of fitness for overall health, but also it shed significant light on the impact on patient well-being. And we are really grateful for your time today. And definitely it will help in coming days, especially for the doctors who have joined with us. It helped them to integrate this particular thing in their treatment plan for the patients. And for our audience, it was truly a pleasure to have such a diverse and knowledgeable group of delegates with us who joined for this meeting. And we believe that the discussion and exchange of ideas have greatly enriched all of you, and we'll definitely get a lot of confidence, which you will use in your day-to-day practice in coming times. So now I would request all the doctors to extend the benefits of UDAPA M for your type 2 diabetes patients who need the first line therapy for better A1C reduction as well as the weight reductions. And UDAPA M is available across the country. So apart from that, we also have various patient care services for which we request to get in touch with our local sales teams, and we definitely be happy to help your patients to provide those services to the patient for your patients for the better patient care. So with this, thanks to all once again who joined with us tonight. Good night, and thank you once again.
Good night. Good night. Thank you.
Thank you, sir. Thank you.
Thank you. Thank you. Thank you. Thank you all.